As a patient, the one place you'd expect to find some form of assistance would be at a hospital or a local clinic. But what happens when people and patients would rather suffer than visit their local clinic? This clearly says something about the country's healthcare sector. The second edition of the State of Health report has revealed that bad attitudes by staff and misplaced files are the norm. Ritshidze Project Officer Ndivhuwo Rambau joins me now from Randburg. Ndivhuwo, thank you so much for speaking to us this evening. This report has shown some alarming findings with regards to ill treatment at local clinics, specifically of people seeking HIV treatment. Can you tell us about some of the main findings?
Hi, thank you so much for having us as Ritshidze. So this is our second edition of the State of Health report, specifically for Gauteng. And one of the key findings we have found this time around during our monitoring is that there are long waiting times that are being reported. We found that patients at 37 facilities reported an average waiting time of 5 hours or more, while at 6 facilities there are patients who've indicated waiting times of 7 hours or more. And of those patients, we are finding that almost 35% indicate that they feel very unsafe waiting outside the queue, essentially, while waiting for the facilities to open, because we have patients who are waiting as early as 4 a.m. In the queues in order to be seen by healthcare practitioners.
And once they get to see healthcare practitioners, the report says that sometimes they are harassed, sometimes their files have been misplaced, sometimes they are refused medication on basis of incorrect information in those files. That must be very disturbing if you are trying to access healthcare. And I would understand that many people, as a result, would rather not seek treatment. But how widespread are these issues? Is it a national issue?
So this report was based on the Gauteng monitoring that we have done. Over the past year, we've basically conducted monitoring in 8 provinces in the country. We monitor facilities in KZN, in Mpumalanga, with the exception of the Northern Cape. And the findings are a bit similar, but in some instances, it's not always the same issues. So, for example, right now when we speak about stockouts, in the Gauteng State of Health report, we only had 6% of patients who reported stockouts. Whereas when we look at filing systems, for example, like 24% of clinics in which we monitored indicated that they're just a very bad filing system. And a bad filing system leads to lost files, it leads to longer waiting times for patients and disruptions for healthcare users. And for those who attended our accountability meeting in Katlehong, there are patients who've indicated that they've had to go to the facility and had a file open for them up to 4 times, and with their very important medical history being lost. And that just makes patients want to stop going to the facilities and end up even defaulting on treatment if they are living with HIV.
Systemic and logistical issues can be solved a lot easier than issues of awareness, issues of attitude. What level of awareness, sensitization around people who are trans, people who are sex workers, those who are drug abusers, is there with regards to staff at these clinics? Are they adequately trained to be caring and nurturing and to provide the kind of care that encourages people to come back?
So when it comes to our key populations, and when we look at our key population data, the qualitative data shows us that our key populations really feel stigmatized.
It looks like we have lost Ndivhuwo Rambau. She was just touching there on the very important issue of stigmatization of those looking for HIV treatment. That report telling us some alarming findings. I do believe Ndivhuwo is back now. And Ndivhuwo, are you there?
Yes, I'm back. Sorry, my network is a bit finicky.
No
the weather is just showing us flames.
Please continue. You were talking about stigma.
I was talking about key populations being discriminated and stigmatized when they visit facilities. And I think the key finding that we found in Ritshidze is that out of 118 facility managers who we spoke to, only 27 facilities reported offering services specific for transgender people. And out of those 27 facilities, only 5 offer hormone therapy. So when we do speak to key populations, they do indicate that they are much more comfortable visiting clinics like Wits Reproductive Health, where they are treated with respect. They are treated by people who are also under the LGBTIQ umbrella, and that makes them feel in a safe space. When we look at sex workers, we've had sex workers who've indicated that they would prefer not to go to the facility or even access their treatments, because if they try to ask for condoms, they're asked what are the condoms for, and essentially that stops our key populations from visiting facilities, and that is basically a hindrance on us reaching the 95 targets in South Africa.
Ndivhuwo, very quickly, because we've run out of time, what's the next step towards addressing these worrying issues? What's going to happen?
So we have shared the report with the Department of Health. We've shared our recommendations, and these were also accepted by the Department of Health, who were also within our meeting. And we are going to continue monitoring facilities, coming up with community-led solutions to ensure that our facilities are a safe space for everyone that visits them, especially people living with HIV.
Thank you very much for taking the time to speak to us and telling us about that report, the Ritshidze report. That was Ndivhuwo Rambau.